We love prednisone because it helps us feel better, but we hate prednisone because it has so many side effects. Wouldn't it be great if there was something we could do for that? Well, what's amazing is nature created a compound that might help counteract many of the side effects. This is me and the side effects I suffered while on prednisone. And this chemical, berberine, is naturally found in many plants in traditional Chinese medicine. And all of these highlighted yellow side effects might be counteracted by this amazing natural compound. So, what in the world is berberine and why am I mentioning it today? Well, recently on social media, berberine has been all the craze. People are calling it nature's Ozempic, that really popular weight loss drug, because berberine can help with weight loss. It's amazing. In addition, it can help with all of these other side effects. It's naturally found in golden seal and Indian barberry and other naturally occurring plants. It's a yellow color and it's kind of bitter tasting. It's in Ethiopian foods, traditional Chinese medicine. It's this naturally occurring compound in many plants and supplements that people often are taking and don't know that it is included. So, berberine has been studied in hundreds of studies, and some of the results of those studies have shown the following. I love Natural Medicine's database because they rank studies and evidence by how good the evidence is, how many people were studied, just the quality of the information. And this is what they said about berberine. They said that berberine is possibly effective. So that's a pretty high ranking for them when it comes to supplements for diabetes. Taking berberine by mouth seems to slightly reduce blood sugar levels in people with diabetes. One study showed it was even as effective as prescription diabetes medications. That hasn't necessarily been completely proven, but that was one study did show that. And what's amazing for people on prednisone is a glucocorticoid, as in glucose, as in blood sugar. And so what prednisone does is it raises your blood sugar. And berberine helps lower your blood sugar, both your postprandial and your fasting blood glucose. It has been shown to lower your A1C, your hemoglobin A1C, by almost 1%. Depends on the dose you're taking and things like that. But it is amazing for people with diabetes. So that's the first one. The second one that Natural Medicine's database says that it's effective for is high levels of cholesterol, or the medical term hyperlipidemia. What they said is that taking berberine by mouth might help lower total cholesterol, low density lipoprotein, that's your LDL or the bad cholesterol, and triglyceride levels in people with high cholesterol. So the three big things that they measure, it might help lower all of those things. Then one of the worst side effects of prednisone is heart disease, and high blood pressure is the third thing it can help with. If you take, according to this study they found, is 0.9 grams of berberine by mouth every day, along with a blood pressure lowering drug, amlodipine, reduces blood pressure better than taking amlodipine alone in people with high blood pressure. So it can really help with blood pressure. And then fourth is they say it can help with PCOS, which is polycystic ovarian syndrome. That's not a prednisone side effect though, so I'm not going to focus on that. What I am going to focus on is another study that summarized all of the ways that berberine might help. And I'm going to just go like this for if that's a prednisone side effect as I read off what they said it can help with. Have you seen the fancy medical language that they use? And then I'm translating that into simpler English. That berberine helps with blood glucose, diabetes, insulin resistance, and cholesterol and triglycerides, improves energy expenditure, helps lose weight, improves heart rhythm, reduces blood pressure, and helps build bones. Every single thing that they said that berberine can do is a prednisone side effect that is awful. So like they match up perfectly in what berberine can do and what we need as prednisone side effects to counteract it. It's this beautiful, natural remedy to support you while you're on prednisone. Like all of those things, according to studies, are problems that berberine can help with. Like it's such a perfect match. In addition, berberine is protective to the brain and does so as an antioxidant. And then it is especially helpful for people who have other diseases like cancer. It can help prevent cancer getting worse. It can help with the side effects of chemotherapy or radiation. And it can help with other diseases. Like the reason I had to take prednisone is a disease called ITP, immune thrombocytopenia. Berberine can help boost platelet production by helping with the gut microbiome, counteracting dysbiosis. I didn't even know that my gut had anything to do with my disease at all. And if I had known, I could take berberine and it would support my gut in losing the ability for prednisone to work. They said, the study specifically said that berberine may correct corticosteroid resistance induced by gut microbiota dysbiosis and immune thrombocytopenia. That's what the study said. So basically, when I took the prednisone, the first time it worked amazingly well. The next time it worked a little bit well. And the more times I took it, the worse it worked for me. My body became resistant to it. That's called, in this situation, corticosteroid resistance. I wasn't responding to the prednisone anymore. And this study, published in 2018, shows that it could have been the gut microbiome, that my body was changing my gut, the bacteria in my gut, and that berberine helps to get the right ratio of gut microbiome, good bacteria, bad bacteria, that I was getting more and more bad bacteria build up. And that's what was causing the prednisone to not work as well for me in my condition. I don't know if that's the truth for any other condition, but according to the study, that's how it works for my condition, ITP. So that's pretty amazing that it can help with that condition. Another condition it can help with is non-alcoholic fatty liver disease. And a lot of these conditions are related to metabolic syndrome, or as Mark Hyman calls it, diabesity, things that are related to high blood sugar, high cholesterol, high blood pressure, all of those things that are a problem with the metabolism. And berberine can help with all of them. It's just an amazing natural substance that we can use. And if that wasn't amazing enough, what surprised me again, as I was reviewing the studies today, was berberine can also help with bone health. And there aren't a lot of permanent side effects to prednisone, but one of them is osteoporosis. Osteoporosis, that bone loss, you can never get it back. But if you take berberine, it's shown to, according to one study, berberine has a definite effect in promoting the proliferation and differentiation of osteoblasts, as well as inhibiting the production of osteoclasts to promote bone regeneration. So what it's saying is it helps the bone builders, the osteoblasts, and it stops the bone breaker downers, the osteoclasts. That's exactly the opposite of what prednisone is doing. Like prednisone is making your bone break down faster, and the bone builders aren't doing their job. Like they're the exact opposite. It's this perfect match. Back to diabetes, one of the ways they think it works is by the AMP kinase, inhibiting that, and prednisone is affecting the AMP kinase. So it's like berberine, prednisone, the side effects of prednisone are counteracted by berberine. And that's amazing. And so how would you take berberine if you wanted to take it? Well, this is what you should do. You can take anywhere between 15 milligrams to 1,500 milligrams, depending on what you're needing it for. For my condition, they noticed 15 milligrams was just enough. For like really high blood sugar, really bad diabetes, for weight loss, you get up to the 1,500 milligrams per day range. And if you want to get that high of a dose, you would split it into 3 meals a day. So you take 500 milligrams at breakfast, 500 milligrams at lunch, and 500 milligrams at dinner. And then If you do so, what side effects might you experience from the berberine itself? And they are usually related to the gut. I told you that berberine affects the gut microbiome. It can cause diarrhea, constipation, gas, or upset stomach. So you could start out potentially taking a lower dose and building up to that full 15 milligrams a day. That might help with those side effects. So this all sounds amazing and good, but is it right for me? You might be asking. Basically, who is berberine not for? And I've noticed a few people who should definitely not take berberine. And that's definitely people who've gotten a transplant and are taking tacrolimus or Prograf. It's an anti-rejection medication that you have to take the rest of your life to keep your kidney, for example. And there's a drug interaction between berberine and Prograf, which is also tacrolimus. Another similar drug is cyclosporine. There's a drug interaction between berberine and cyclosporine. So if you're also taking those drugs, definitely do not take berberine. It will mess up your situation. Other drugs that may interact include drugs that are metabolized in your liver by certain enzymes called the cytochrome P450s. There's 3 P450s that berberine affects, the 2C9, CYP2D6, and CYP3A4. So if you're taking a medication like that, you're like, what? That's a thing? Talk to your pharmacist. They can tell you whether you're taking a medication like that. It could change the balance. On the government published website all about berberine in the Office of Dietary Supplements, they said that berberine can affect, like, people who are taking medications for diabetes, right? Because it's helping change your blood sugars. So you might need a different dose of your diabetes medication, or it might affect your blood pressure medications. So you might need a different dose of blood pressure medications because the berberine might be helping. Or it might help with your cholesterol medications and may need less of a dose of that. So those are drugs you might want to look out for. Make sure you're taking the right dose. Talk to your pharmacist and doctor about that. Finally, people who are pregnant or breastfeeding should not take it. And then where can you get berberine? What berberine sources do I recommend? So when I took prednisone, I wish I'd known about berberine and many other amazing things that can help while you're on prednisone. And so I invented a supplement called Nutranize Zone, and it has berberine in it. And it's kind of a lower dose though. So it'll get you that baseline that you need. But if you need a higher dose, then I highly recommend Integrative Therapeutics, berberine, or Thorne Labs, berberine, or Designs for Health, berberine. Those are all great supplement companies that I recommend, and I have links below where you can find those. So to conclude, berberine is an amazing, naturally occurring compound that's found in many herbs and plants, and it can help to counteract many prednisone side effects. Definitely talk to your doctor about this. What I'm saying is emerging research. They have hundreds of studies, but there's so much more research they can do to find out really the precise dose and exactly how it works. So I'm hopeful that we'll learn more in the future, and definitely take this all into account as something you need to talk to your doctor first before starting. Signing off is Dr. Megan, your prednisone pharmacist.